stop for a moment. You may already have diabetes and not even know it. Hello, I am Dr. Elira Vance, your medical guide. Today, I will show you the early warning signs of diabetes that most people ignore. Before we talk about the signs, you need to understand what diabetes actually does inside the body. Because once the mechanism makes sense, every single symptom on this list becomes completely logical. Your body runs entirely on glucose. Every cell, every organ, every thought your brain produces requires glucose as its primary fuel. When you eat, your digestive system breaks food down into glucose, which flows into your bloodstream. Your pancreas then releases a hormone called insulin. Think of insulin as a key that unlocks the door of each cell and allows glucose to enter and be converted into usable energy. In type 2 diabetes, which accounts for around 90 to 95% of all diabetes cases worldwide, something goes wrong with that system gradually over time. Your cells begin to resist insulin. They stop responding to the key the way they should. Your pancreas tries to compensate by producing more and more insulin, working harder and harder to force the door open, until eventually it simply cannot keep up. The result is that glucose builds up in the bloodstream instead of entering the cells that need it. Blood sugar rises, and that excess glucose circulating through your body begins doing damage to large blood vessels and tiny ones, to nerves throughout the body, to the kidneys, to the eyes, while your cells simultaneously starve for the energy they cannot access. This process does not happen overnight. It develops over months and often years. And during those months and years, your body is speaking, sending signals, waving flags that something fundamental is changing beneath the surface. Here are those signals, and here is what they actually mean. The first sign is one that almost everyone dismisses immediately because it has what feels like an obvious explanation. You are thirsty, so you drink. And then, not long after, you are thirsty again. When blood sugar is elevated, your kidneys go into overdrive trying to filter and remove the excess glucose from the bloodstream. To do this, they pull fluid from your body's tissues. The result is that you are constantly losing more fluid than normal, and your body is sending urgent, persistent thirst signals trying desperately to replace what is being lost. The medical term for this is polydipsia, and the word that matters most in understanding it is persistent. This is not the thirst you feel after a long walk on a summer afternoon. This is not the thirst from eating something salty at dinner. This is a thirst that stays with you. A dryness in the mouth and throat that returns quickly no matter how consistently you are drinking throughout the day. Most people explain this away. The weather, not drinking enough, eating too much sodium, and because there is always a convenient alternative explanation available, the real signal keeps getting ignored for weeks, for months, sometimes for years. If you have noticed that your thirst levels have quietly shifted upward, that you are consistently, reliably thirstier than you used to be as a new normal, that is not nothing. That is your body speaking, and it deserves to be heard. This sign and the last one arrive together. They are two sides of the same physiological coin. Because your kidneys are pulling fluid to flush out excess glucose, and because you are drinking more to replace that lost fluid, you are also urinating far more frequently than before. The medical term is polyuria, and the pattern it creates is distinctive. Frequent trips to the bathroom throughout the day, and this is the part that disrupts lives most significantly, multiple trips to the bathroom through the night, interrupting sleep consistently, leaving you exhausted by morning. Many people attribute nighttime urination to aging, to drinking too much tea before bed, to a bladder that is simply getting older, and sometimes it genuinely is those things. But here is what matters. When frequent urination appears alongside persistent, unusual thirst, when those two experiences are happening together as a new pattern, that combination is one of the most classic early pairings of diabetes, and it is also one of the most consistently explained away. Together, these two signs, the thirst and the urination, are your body's most direct early communication that something is wrong with how it is handling blood sugar. When both are present together, a blood sugar test is not optional, it is necessary. This is perhaps the most universally dismissed early sign of diabetes because everyone is tired. Modern life manufactures exhaustion at every turn. There are always reasons to be worn out, but the fatigue that comes with early diabetes has a specific quality that separates it from ordinary tiredness. And once you understand what causes it, you will recognize exactly what makes it different. When your cells cannot properly access glucose because of insulin resistance, they are running on insufficient fuel. Your body is like a car with a full tank of petrol but a broken fuel pump. The energy exists. The system cannot deliver it. And everything, every physical movement, every mental task, every conversation requires more effort than it should. The result is a heaviness that sleep does not resolve. You go to bed exhausted. You sleep a full night. You wake up feeling as though you barely rested at all. A persistent, bone-deep fatigue that follows you from morning through the day, regardless of how much rest you get. This kind of tiredness tends to arrive so gradually that most people barely register the change until they try to remember the last time they felt genuinely energized. And when that question is difficult to answer, when you cannot pinpoint when your energy shifted, that gradual change is exactly the pattern that early diabetes produces. Tiredness has many causes, but tiredness that is consistent, unrelenting, and unresponsive to rest deserves investigation, not acceptance. The eyes are among the first organs to reflect what is happening with blood sugar levels, and the mechanism is surprisingly direct. When glucose is elevated in the bloodstream, it causes the lens of the eye to swell as fluid shifts in and out of the surrounding tissue. When the lens changes shape, its ability to focus changes with it. The result is blurred vision, and crucially, vision that fluctuates, sometimes clearer, sometimes worse, shifting in ways that do not follow the predictable pattern of ordinary eyesight decline. Many people who experience this in the early stages of diabetes simply schedule an eye test. They get a new prescription. Things seem better for a time. But the underlying problem continues because the lens is still responding to blood sugar levels that have not been addressed. Left unmanaged over years, diabetes causes diabetic retinopathy, damage to the delicate blood vessels lining the retina. This is one of the leading causes of preventable blindness in adults across the world. The distinction to watch for is this: if your vision is not simply declining gradually, but actively fluctuating, clearer some days, blurrier others, shifting without a clear reason, that pattern warrants more than a new pair of glasses. It warrants a blood sugar check alongside the eye examination. Your optometrist sees the blood vessels in your retina. A good eye examination can actually show early signs of diabetic damage. Make sure your eye doctor knows your full health picture. This is one of the early signs that almost nobody connects to blood sugar, and yet it is one of the body's most consistent early communications that something is wrong. You get a small cut, an ordinary minor injury, and 2 weeks later, it is still not properly healed. You notice that bruises linger longer than they used to, that small skin infections take longer to resolve, that your body seems to recover from minor physical injuries more slowly than it did in previous years. Elevated blood sugar impairs the healing process through several mechanisms simultaneously. It reduces the effectiveness of white blood cells, the cells responsible for fighting infection and repairing damaged tissue. It damages the microscopic blood vessels that deliver oxygen and nutrients to healing tissue. And it creates a higher sugar environment in the tissues that bacteria thrive in, making infections both more likely and more persistent once they take hold. In early diabetes, this shows up as a subtle but real change in recovery time. Nothing dramatic enough on its own to trigger alarm, just a quiet shift in how efficiently your body bounces back from the minor injuries that are simply part of daily life. Pay attention to how you heal. The timeline of your body's recovery from small injuries is a window into what is happening with your blood vessels and immune function below the surface. This sign carries particular urgency because when it appears, it means nerve damage has already begun. which is precisely why catching diabetes before this symptom develops is so critically important. But for a significant number of people, this tingling or numbness is the sign that finally brings them to a doctor. The condition is called peripheral neuropathy. Chronically elevated blood sugar damages the small blood vessels that supply the nerves throughout the body, particularly the long nerves running to the hands and feet. As those nerves are gradually deprived of their blood supply, they begin to malfunction. The sensations it produces vary from person to person. Some people experience a tingling or pins and needles feeling in the feet or fingertips. Some notice a burning sensation, particularly noticeable at night when there are no other distractions. Some experience numbness, areas that respond less to touch or temperature than they used to. Some notice a combination of all of these that comes and goes unpredictably. What makes this sign so important to understand is this: nerve damage, once it occurs, is difficult and sometimes impossible to fully reverse. Managing blood sugar effectively can halt or significantly slow its progression, but it cannot always undo what has already happened. If you are experiencing unexplained tingling, burning, or numbness in your extremities, even occasionally, even mildly, this is not a symptom to monitor and wait on. This is a symptom that requires a medical evaluation without delay. This final sign seems almost paradoxical at first. How is it possible to feel hungry shortly after eating a full meal? But once you understand what is happening inside the cells, it makes complete biological sense. When cells cannot properly absorb glucose because of insulin resistance, they signal hunger to the brain, because from the cell's perspective, they are genuinely and urgently starving for fuel. It does not matter that there is plenty of glucose in the bloodstream. The cells cannot access it. So they keep sending the signal, we need more energy, we need more food. The result is a persistent gnawing hunger that returns surprisingly quickly after meals. A feeling of incompleteness even after eating a full and adequate amount. Strong and unusual cravings, particularly for carbohydrates and sugar, that feel almost separate from genuine physical hunger, but are difficult to ignore. In some people, particularly in earlier stages, this increased appetite appears alongside unexplained weight loss, because when the body cannot access glucose for fuel, it begins breaking down fat and muscle tissue instead. Eating more but losing weight is one of the more striking patterns that sometimes accompanies early diabetes, and it almost always warrants urgent medical evaluation. 7 signs. 7 ways your body tries to tell you that something important is changing. Long before a diagnosis is ever made, long before a blood test is ever run. Persistent thirst that returns even after drinking. Frequent urination, including multiple times through the night. Fatigue that a full night of sleep does not resolve. Vision that blurs or fluctuates from day to day. Cuts and wounds that take longer to heal than they should. Tingling, burning, or numbness in the hands or feet. And hunger that comes back too quickly after eating. None of these signs alone is a definitive diagnosis. Any single one of them can have another explanation. But if you are experiencing several of these together, or if any of them represent a real change from what has been normal for you, that pattern deserves a conversation with your doctor and a simple blood test. The test itself could not be more straightforward. An HbA1c test measures your average blood sugar over the past 3 months with a single blood draw. A fasting glucose test requires nothing more complex than skipping breakfast before a routine check. Simple, accessible, and potentially one of the most important pieces of information about your health that you have ever received. Here is what makes this truly urgent. Prediabetes, the stage before type 2 diabetes fully develops, is reversible in many people. Lifestyle changes, including dietary adjustments and regular physical movement, have been shown in major clinical trials to reduce the progression from prediabetes to full diabetes by more than 50%. 50%. With lifestyle changes in that window before the diagnosis is confirmed. But that window closes over time. The longer elevated blood sugar continues without being caught and addressed, the more damage accumulates and the harder the reversal becomes. The time to act on these signs is not next month. It is not after they get worse. It is now. While the options are the most powerful, while the damage is the most reversible, while the window is still open. If anything in this video described something you have been quietly experiencing and explaining away, please make an appointment with your doctor this week. Your body has been trying to tell you something. Now you know exactly what it has been saying.